Dr. Sutharshan, in addition to his esteemed reputation as a renowned surgeon in the peninsula, he is revered among both medical undergraduate and postgraduate students for his exceptional teaching prowess. His dedication to the education extends beyond the operating room as he invests significant time and effort in mentoring and shaping the next generation of the medical professionals. Without further ado, I invite Dr. V. Sutharshan to podium to share his vision, aspirations, and the words of encouragement.
Our chief guest today, Dr. Lalandha Ranasinghe, and his wife, Dr. Nishadya Ranasinghe. Guest of honor, Dr. S. Premakrishna and his wife, Jayasri. The Vice Chancellor of the University of Jaffna, Professor S. Sri Satkunaraja. Director of the Teaching Hospital Jaffna, Dr. T. Satyamurthy. Acting Dean, Faculty of Medicine, Dr. Dinesh Kunje. The Regional Director of Health Services, Dr. A. Kediswaran. Professor in Biochemistry and former UGC Commission member, Professor Vasandhya Rasaratnam. Outgoing President of JMA, Dr. Krishanti Rajasurya. Esteemed past presidents, members of the council, my teachers, colleagues, friends, relatives, and students. Thank you for all being here to witness this induction ceremony of 83rd President of JMA. In particularly, the outgoing President, Dr. Krishanti Rajasurya, and her team for doing a wonderful job during the last tenure. I express my sincere gratitude to the Jaffna medical community for electing me as the President of JMA for 2024. I take this opportunity to remember all those who stood behind in making the JMA a gigantic organization at present. I will try my best of efforts to keep the JMA upgraded to the next level. Also, in the next few minutes, I try to recall my memories of those who were behind the making of me as I am today. As my mentor, teacher, trainer, Dr. Lalandha Ranasinghe said when he met us for the first time, Sutharshan, I am a rural boy. And he keeps on repeating it. That is to make ourselves to see what the pathway he has come all the way through. It's not the direct observation and things you always learn from your trainer. There are indirect things. The trainees will catch it from. That's what he did. So, as you all know, in Hinduism, there's a belief, comes from the Sanskrit mythology, Hinduism mythology. There's something called Mada, Pita, Guru, and Deva. When somebody is molded and grown, there is always a priority. Your mother, you learn from mother, starts from her womb. Then your father, beside your mother. Then your teachers and the God. I try to remember few of the saints I have met up to now in my life. I met many saints and sinners, but all of them have helped me to, grow up to this level in one or the other way. This is Mr. and Mrs. Vengadasalam and Kamala Devi, my mother and father. You may ask why I have put this picture. We have lost all the family photographs and childhood photographs during multiple displacements. My photo starts at the age of 20 years. So my mother is a seamstress by her occupation, tirelessly worked to support my father, to bring up their children. I consider the skills I execute now as a surgeon with cutting, suturing and knotting is all imparted from her. When I helped her, when she is busy and when I am free. Then my father is a government servant. He always say something, Tandai Mahatkatam Andri Avayatham Undirapachayal. The benefit of which a father should confer on his son is to give him the precedence in the assembly of the learned. I think he has done his duty. He also says, Mahan Tandai Katamudavi, even Tandai Ennotan Kondenam Sal. I am still trying to do that. So he has taught me many things for the benefit of the community. I will tell two things. He is the best accountant I have ever seen, because over many decades he maintains a diary of expenses and income. Even we spent a cent, we had to be accountable. The same thing I practice when it comes to the patient care. When you handle public money. The second thing that I think the most important thing he has done to his kids, he was an avid lover of alcohol. And he stopped all of a sudden when he put me to the primary school on the first day, which he continued to do so over many decades till all his children finished their undergraduate training. At the end of the day, when he asked all three of us, can I start now taking alcohol? I couldn't say no. Then it comes to the teachers. I think there are few in the audience. Mr. Balachandran, my class teacher, during my O-levels. Those days I used to travel 20 kilometers from the morning and evening by cycling during the peak of war. My 3 years of school days were like that. When I come to the school, after the intervals, I become deadly tired. I used to sleep during the last 2 periods. Now he kind-heartedly told the other teachers also, don't disturb him. When he came to me in the private practice, when I did a free service, he came and asked why. Then I said, if I am going to charge you, I have to stop doing my private practice. So then you see my teachers in the A-level. Sadly, the story continued in the faculty. I continued to sleep during the lectures. One fine day I was sleeping during Professor Lal Jayakodi's lecture. On the first row, I was just in front of him. He saw me sleeping and told, Mela mea budine. This child is sleeping. So the next person was just kidding me, called Rasika. He was kidding me. I was just coming out of my sleep. Then there was an auditorium full of laughter. I thought the scene is going to be worse. Then I continued to sleep until he goes out to the lecture room. So then you see Mr. Thambaraja was my zoology teacher. He taught us only what is necessary. That's the reason why I secured 4 A's after a long gap in Jaffna Peninsula. After several years, we have broken the record to get a 4A. And Mr. Gunasilan is out there. He's more than a teacher to me. And Mr. Sodilingam, I think he must be there. He was our class teacher. Before he was a tuition teacher. And from the first day he asked few questions to me and then I answered. He said, you will study here freely for the rest of 2.5 years. Then late Captain Nagaratnam, he was my chemistry teacher. He was the partner in crime with my father at the Jaffna in the college and University of Peradeniya. He looked after myself as his kid. And the reason why I got all 60 MCQs correct at the chemistry. Then there are a few during my undergraduate training period. Philip G. Veerasingham and Professor H. Sharifdeen. They were living examples who pushed me into the surgical career. Then it comes to my general surgical trainers. I started my first year training with Dr. Semaka Jayasekara. So my surgical endoscopic skills are all from him. It was 15 years ago. He did all the advanced endoscopic procedures when I was assisting him. And my dexterity and hand skills are mostly from Dr. K.S. Pereira. And Dr. Lalandar Anasinghe, today's chief guest, he has made a major behavioral change in the way I look at surgical practice. And he used to say it's honesty and trustworthy and academic excellence. There are 3 important things for a clinician. I think I have become trustworthy because whenever there is something wrong happens in the ward, the first thing he comes and asks, Sutharshan, is it true? My colleagues will wait whether I am going to say yes or no. I think I will never lie to him. And late Dr. Atula Vithanage was my trainer in UK. He housed me in Wales in one of his own houses, looked after me. I went to UK very soon after the end of war. The Tamil community and the Sinhalese community, doctors, they don't talk to each other. So when I reached to this person of a different race, then my own community, they didn't speak with me for a while. At the same time, when 3 people from Sri Lanka, the other 2 are Sinhalese, were applying this post, he only selected me based only on merit. But very sadly, he died of a brief illness last month. So the teachers and then God. a firm believer in God, but I don't have any agents in between me and God. In Tamil, a popular saying, Seyyam Tolile Deivam, what your occupation is your God. And I think I consider my surgical practice as, and my patients as my gods and teachers. Last but not least, this is my world, my family, my wife Gayatri, daughter Shentana, sons Janandanan and Thanujanan. They all support me unconditionally during all my endeavors so that I could do all what I do now. Actually, I wanted to extend this family to 5. Sadly, Professor Mohandan has shut down the factory. He's out there. Right, so there's a brief token what I wanted to say. There is something called augmented surgery. Before coming to that, Jaffna Medical Association has selected the theme as efficient healthcare, achieving with the merest. Especially the downfall of the country's economy, we selected this theme. When it comes to the practice of healthcare, it is evolved with evidence. It is evolving. Day by day, the evidence from research, audits, will produce new evidence to say the new treatment is better than the old, or the older treatment is better than new. So the practice evolves. The today's practice may not be right tomorrow. When some of the students at the end of the appointment with me overwhelmingly say, "Sir, I want to become you," I said, "No, don't become like me. When you become a surgeon like me, you will be outdated. You think about becoming a surgeon, me plus another 15 years. So the concept of surgery was explored well before recorded history, with early surgeons grasping the basic concepts of human anatomy and organ systems. You see, this is 35,000 years ago, a child with a leg amputation. So there are holes in this French skull excavated 9,000 years ago. These are surgically driven holes called trephinnes or burr holes. Then in 1540, some English barbers and surgeons unite to form the United Barber Surgeons Company. Why barbers came into the scene? Because they had the sharpest knife. They unite with the surgeons and then the apprenticeship, and it went on. You know, when it comes to the medical students' exams, there are some MCQs which are put as trial MCQs. We had an MCQ in medicine. One stem says, all the surgeons are barbarians. I don't know who put it, and I don't know how to mark it. Then you see Wilhelm Fabry, known as the father of German surgery. He is the first surgeon to employ amputation as the treatment for gangrene. Then one of the major breakthroughs is anesthesia, started with Morton's ether inhalation in 1846. And the first X-ray is performed in Germany, 1895. And you may see this Henry Hamilton Bailey. He's a well-known surgeon, and he cannot be forgotten, because all the medical students should know and will know that, because he is the author of the best-selling medical books up to now. Can anyone identify anything abnormal in his photo? These are his actual hands. He lost his index finger on the left side. When he was a trainee surgeon, he pricked his left index finger, and for the fear of developing gangrene, at that time there is no antibiotics and no anesthesia, and they had to amputate his index. And he has been asked to go out of the training, but he never did. He continued to work, continued to write books, and he was a well-known person with psychological disorders. He was imprisoned for 3 years. Again he came and started working, write many books. Now you see, he has only 4 fingers. You see Robert Liston. This was mentioned in text. He did surgery of an amputation of a limb. He is supposed to have done it in 2.5 minutes. And apparently the leg and the testicle were cut. Patient later died of a hospital gangrene. He has cut the assistant's hand also. The assistant also died. And the bystander was looking at him. With the sharp knife, he has scratched his cord, so he got frightened and had a heart attack and died. So this is one surgery with 300% mortality. But people say it could be just an apocryphal story. But I just want to mention the speed. The people who had sharp knife and the speed cutting skill were regarded as the best people at that time. When it comes to the ballistic wounds, in those US and French ships, now they have a hot oil burner. Well, that was a treatment for bleeding wounds. You just pour hot oil into the wound. Already wounded person, you put hot oil into the wound. People die of hot oil as well, immediately, pain. Ambrose Paré, a French surgeon, he is the one who started to ligate blood vessels. Then a major breakthrough came in the form of antibiotics, initially penicillin and then the other forms. Then during 20th century, the surgery has become safer and more effective thanks to the better anesthetic techniques, better antibiotics, and the energy devices we use to cut, coagulate and ligate blood vessels. When it comes to major surgeries in 21st century, surgeries become smaller and safer. There is an old saying called big surgeons make big incisions. I hate that wording because the meaning could be duplicated in my context. So the surgery has moved from radicalism towards minimalism. Minimal incisions, minimal anesthesia, minimal hospital stay, minimum bleeding, that's how it evolves. And how it evolves is because the augmentation, that is to increase something, no? The word augmentation means. What is the meaning of augmented surgery? Now, anyone who drives a car or bike or bicycle, or even if he just walks on his foot, should know that it's a process of vision and the process in your brain, and your hand or foot skills which are coordinated. I consider the most of the road traffic accidents are due to the processing in brain problem. So each of these components slowly get augmented during the decades and over the years. When it comes to the augmentation of vision, now I've seen some of the doctors had this hand lens to look at the wounds. Still I have a lens. Then it comes to the loops, which give a better magnification. Then it came to the microscopes. Then it became to the high definition and ultra high definition screens in laparoscopic surgery. Then it came to the 3D view. Then the robotic equipment. You see the robotic arm is separate from the console where a surgeon operates from slightly a distant place. The distance could be increased when the 5G become full-blown and without any delay in transmission of data. Actually, that was tried. Somebody from France was operating in America. The console in one place, the system of equipments, the instruments in another place. But the actual cost, I was slightly inquisitive of finding out how a laser would work for Jaffna. The price is $3 million. Currently the monopoly is with one of the companies in US. Hope when we have the other companies from the subcontinent start producing low cost ones. When it comes to augmentation of processing, I think we all did human anatomy from all these textbooks and dissections of human body and directly learned at the dissections at the operation. Now there are more things. Now the issue is, when you learn it from a book, what you have and your brain process is what is in the book. That may be totally different from what is in this particular patient. So we have a mental picture of this is how liver looks like, or this is how gallbladder looks like, but the picture for that particular patient may be totally different. So there are newer modalities to make sure the anatomy is studied before you embark on surgery. X-rays, CT scans, MRI scans. Then it could be real time. And you operate, at the same time you do a X-ray, same time do a CT. Same time you can navigate where you touch in the brain, your screen will say you have taken the whole tumor or not. So those things have made the surgeon's duty less difficult. And the surgeries have become more minimally invasive from radical operations. Why a surgeon would remove the whole breast? Because he has the fear of having the other spots of malignant cells in the breast. Now, if you can find out where exactly the tumor cells are, and the rest of the breast is normal, why don't you take only that area out? That is what the current practice is. So the surgery is moving towards minimalism. That has benefits to the patient. In case of recovery, blood loss, infection, and the outcome remain the same. When it comes to the augmentation of hand scans, these were the oldest instruments were used, and if the patient see this kind of instruments nowadays, they will run out of the hospitals. But those days they can't run, there will be people holding the patient, and then the surgeries become refined and sterile. The micro instruments came into the market, and then the laparoscopic instruments. This is what the robotic arm I was talking about. So, ladies and gentlemen, this is the day and age of minimal access era. And this is one slide I have put here to compare the open hernia surgeries versus laparoscopic surgeries, which are marked in red. Over the last 4 years in my unit, you see the gradual increase in the laparoscopic surgeries and gradual decline in open surgeries. Now you see the open appendicectomy and laparoscopic appendicectomy. You almost never see an open appendicectomy, which is in blue color, because we did only one case on each year. So I take this moment to happily announce this is the first unit in Sri Lanka to achieve almost obsolete open appendicectomy rates. We are hoping to continue to do zero open appendicectomies, minimal laparoscopy to open conversion, and zero open cholecystectomies. May not be possible, but that's how we hope. So, ladies and gentlemen, all this augmented surgery has revolutionized the surgical care and taken the surgical care from radicalism towards minimalism. But still, there are limitations. Very soon after the COVID outbreak, the country has gradually fallen from upper middle income country to lower middle income country. The budget spent on health was not like expected. Very recently, the Ministry of Health has reduced surgical consumables from more than 700 to 150. So there is a big problem in front of us as far as the resources concerned. There is shortage of equipments and resources. We are compelled to reuse disposable instruments. We have no way of repairing the available ones. There are financial restrictions, and also putting oil to this ballistic wound, there are migration of skilled doctors and trainers. So I have been trained in an era where I can do both open operations and minimally invasive operations. I can go back and do open operations. But you may see this slide. Last year in November I presented in Raipur, India, what solutions we have. I have only 2 instruments and suture. We don't have any energy devices. All sorts of operation we try to navigate. We try to overcome the problems we have with poor resources with skill mastery. So, ladies and gentlemen, efficient healthcare, achieving with merest, it's a suitable theme we have selected for the practice which evolves around medicine. At the same time, the developments we have in the country's economy. I hope I will take this opportunity during 2024, as the president of JMA, I try to deliver the expectations bestowed upon me. And I thank you all for present here and bless me on this occasion. I take this moment particularly to thank my council for their untiring support and my registrar Braniv, who has prepared these colorful slides. Thank you.